I just wanted to get your views on how the dynamics in the industry are changing given increased competition from consumer companies.
Today we have the likes of Apple, Google, and now Amazon, as you said, adding more health monitoring capabilities to their devices. And very clearly, their early forays into this space were wellness. So it was more looking at the general population and trying to give feedback on your state of health, your state of exercise, diet and things like that. I think generally those devices, because they are aimed at the larger population and they have to take a broad view of their application space, they don't meet the need that Beta was just alluding to, which is the very specific set of needs that a patient cohort has. Now, whether that's a chronic disease management challenge or whether it's a subacute monitoring challenge, whether you're looking at early discharge from the hospital, whether you're looking at COVID positive patients who are not sick enough to be taken into the hospital but are being sent home, and looking at platforms that it's not just a set of sensors, it's also what you do with that sensor output. And that is a huge creative challenge for the technology industry to address each of those conditions in a way that really does benefit both the patient and the healthcare provider as well. But it involves semiconductor companies doing things like spending years doing clinical trials, working so closely with cardiology departments across the world and getting involved in so much more than we have in the past. In the past, we thought that our job was to provide critical building blocks to these systems. And increasingly now we're moving into that space. And you would say, well, how can you compete against the likes of Amazon, Google, and so forth? Well, scale isn't everything. Insight is huge in this area. And, the companies that have been serving the hospitals and have been in the ICUs and the ORs to date have a great set of knowledge, and they know how to work with the healthcare providers.
How, as a consumer, when you've got competition, when you've got like the likes of Apple and Google, but then you've also got, more historically healthcare companies with a lot more experience in this field, will it be more difficult to choose, give the experience over the sort of new big name type thing? And how do you compete in that sort of environment? How do you see the dynamics of the industry evolving?
I think the competition will be that the large consumer companies will make incremental progress in coming towards the clinical space, but I don't see them providing breakthroughs in that area. That requires so much focus. I think we saw with when Apple introduced their EKG measurement and got it FDA certified, and one of the things that it was detecting was tachycardia, and then very quickly, it became apparent that there's a large portion of us exhibit tachycardia at various times in our lives, and so therefore, if you're just creating alerts and overburdening a system, that does nobody any good. But looking at all aspects of that patient's health, and then making the transition between the sensors that can measure that patient's condition, and then the algorithms and the software that can interpret that to really provide to the physician the physiological insights that they're used to seeing. And if we can do that remotely, that is a huge breakthrough. And so that's really the challenge that we have before us today. And we're trying to do it in chronic disease management. We're trying to do it in acute and subacute care. But we're looking to bridge that, take the technology and the capability in the hospital, get it out to the home, but combine it with software and interpretation that enables telemedicine providers and ultimately the primary care physician or specialist to be able to interpret that patient's condition with a view to preventing unnecessary hospitalizations, to intervening earlier, and to do a lot of things that will bring the cost of care down without impeding the quality of that care.